Well, again, I appreciate you guys joining me tonight. Uh, as you can see on the screen, we're going to do a just a very quick um, webinar about platelet-rich plasma injections for orthopedic conditions. We'll give a little background about myself and then just talk about what PRP is, and then some considerations on why it can be used for orthopedic conditions, to include arthritis, tendinitis, nerve conditions like pinched nerves or carpal tunnel, bursa, like inflamed orthopedic tissues, and just some things to think about when choosing a provider to perform a PRP treatment. And then at the end, we will have a question and answer time. You guys can jot down some questions in that chat section, which I can get to at the end. There will be some contact information if you need more information from our clinic. So as I said, my name's Josh Goodwin. I'm here at the Regenexx Las Vegas clinic. So just a little bit more about myself. So I'm a medical doctor. I graduated from the University of New Mexico School of Medicine. I'm board certified in a field of medicine called physical medicine and rehabilitation. I am fellowship trained in sports medicine and interventional spine. So most of my training is non-surgical. I'm not an orthopedic surgeon. I do all non-surgical injection-based treatments. I've been with the Regenexx organization since 2015. I don't have too much about who and what Regenexx is, but essentially it's a large network of physicians that's been around for 20 years, focused on non-surgical orthopedic care. And a big portion of our treatment is very customized PRP injection-based treatment for orthopedic conditions. I am a co-author on some articles that explore stem cell treatment for low back pain. So we're just going to dive right into it. Again, ask questions if you need to, and I'll get to those at the end. Make sure I have this up. So let's just jump into it. What is PRP? I think more and more people are hearing this term, or people are exploring different options when it comes to their orthopedic care. People are used to getting prescribed their anti-inflammatory or their pain medication, or getting sent for cortisone steroid injections, and people are often looking for alternatives, something that might be more effective, healthier, have some potential for healing, can last longer than these other options with less side effects and less downtime, or that might be able to help people progress on to surgery and kind of prevent that next step in the traditional orthopedic algorithm for orthopedic conditions. So specifically, when we're talking about PRP, that stands for platelet-rich plasma. And so if you don't know, within our own bloodstream, we have cells called platelets, and these have many functions in our body. One of which is they are the activators of healing. So when you have traumatic injuries, for example, you cut yourself, you break a bone, you get surgery, you will have some level of bleeding. Platelets, amongst other things, will be involved with stopping that. And then as you can see on the screen, platelets house these different growth factors that are involved with the activation of healing cascades, from the generation of new collagen, which all of our tissues are made up of, new blood vessel growth, wound healing. And this can be very important with regard to why we would want to take advantage of the platelet functions in our body, isolate them, concentrate them, which when we're talking about platelet-rich plasma, we're basically taking people's blood and elevating the concentration of these platelets per unit volume. and then delivering them into areas that maybe need some assistance with healing. A lot of our tissues that don't heal as well tend to be areas that don't have good blood supply, or where the blood supply has diminished over time through repetitive use or the degenerative process. But we all know we have some capacity for healing because we've all cut ourselves, or know someone that's broken a bone or had surgery, and we had to recover from these types of injuries. And part of the process of that is through the function of platelets and the release of those specific growth factors, and how that begins to orchestrate and activate a healing response. And so that can be some of the reasoning why we would want to even explore or think about taking advantage of cells that are already found in our bodies that are typically involved with healing, and maybe isolating them, and putting them in areas where our bodies are showing some inefficiencies at healing. And so one might ask, why should we consider PRP for our orthopedic conditions? As many of us know, there are different options, and many of us have maybe had steroid injections or gel injections or other things that aren't on the screen, like radio frequency ablations, where you like burn nerves, or maybe you're being told you need an arthroscopic knee surgery for a small meniscal tear, or a surgery to debride your rotator cuff. PRP can be very helpful in those situations. So the platelet and the PRP injections can be protective and preserving for cartilage and tendon tissue. If you compare that to cortisone, steroid injections are toxic to cartilage and tendon and actually accelerates degenerative changes. PRP can help initiate a repair response to injured tissue. So it provides this huge growth factor release, which is a huge signal for healing, a more robust signal since the cells are concentrated to higher levels. We know that based on some of the growth factors found within platelets, that new blood vessels can grow into this degenerative tissue, depending on what you're treating. For example, tendon degeneration. There's other proteins and growth factors within the plasma as well, which can be strong anabolic, which means growth type signals for the tissue. A lot of times when we have degenerative processes, we're overwhelmed with a destructive catabolic process from all these enzymes and arthritic chemicals and inflammatory chemicals that linger for long periods of time. And the concentration of those arthritic destructive chemicals can overwhelm the chemical environment of your tendon or joint, which can lead to future wear and tear. And so PRP can start to balance and bring a better homeostasis chemically into the joint to assist with healing, repair, reduction of inflammation, strengthening of the tissue. And as we'll see coming up on the next slide, a properly dosed PRP has been shown over and over to be more effective than steroid injections, gel injections, and some surgical procedures. So again, just looking at data in these randomized controlled trials, some of them for knee arthritis, comparing them to gel, saline, steroid therapy, other types of cellular injections, medications, surgical intervention, those kind of things. So showing benefit, meniscal tears, hand arthritis, hip arthritis, tendon issues around the hip and shoulder, carpal tunnel, elbow tendon issues, SI joint and spine issues, ankle, Achilles, plantar fasciitis, being compared to gel and steroid and saline and shockwave and needling and surgery. Looking at all these things, that they've been compared to showing benefit. And this is with properly dosed PRP, which we'll talk more about what that means. And so when we're trying to look at what types of conditions can be treated, in general, we can treat most areas of that we consider orthopedic tissue. So that includes our spine, from joint arthritis, irritated nerves, disc bulges and herniations, shoulder issues like arthritis or rotator cuff issues or bursitis, elbow, arthritic change or tennis elbow or other tendon nerve issues, carpal tunnel and arthritis of the hand and wrist, hip, labral joint tendon problems, knee arthritis and ACL sprains and meniscal tears, and same thing with the ankle with the Achilles plantar fascia. In general, it's better for mild to moderate arthritis as opposed to more severe degenerative changes. It's better for smaller tears as opposed to larger tears. Inflamed tissue or more degenerative tissues can be improved. Pinched nerves in the back, sciatica and disc bulges, carpal tunnel in your wrist, or other peripheral nerve entrapment issues. And so PRP can be utilized in all of these different situations. Again, with comparative studies against more traditional treatment options showing equal or superior outcomes. Now, there's a lot more to consider when getting treated with PRP. It's not the right choice for everybody. As we mentioned, there are certain types of issues that it seems to be better for, and other types of issues it may not be as effective for. You can think of PRP like a medication where people will do better when given a specific dose of those platelets. And we're starting to learn more and more about the dosing effect of platelets. And if we looked at some of the failed PRP studies, it tends to be in low dose platelet injectable therapies as opposed to high dose. And age can play a role, tissue type can play a role. So understanding that not all PRP is the same. Once you have the proper dose of platelets, you need to be able to precisely deliver them to the proper locations so that the tissue that needs the assistance and all that signal is going to be delivered and bathed in this tissue at the proper dose and concentration. And so these important factors, moving on to the proper evaluation, we have to remember again that not everybody's going to be a good candidate for PRP. So if you're seeking someone out for treatment, it's good if they have an understanding of what's going on structurally in your body. So this has to include a proper clinical evaluation with physical exam, imaging finding, ultrasound, x-rays, MRIs. They need to sit down and review those with you so that everybody understands what's going on structurally and how that may influence the potential outcomes with PRP treatments. So for example, overall potential for success is better if you have more mild to moderate arthritis in the knee as opposed to bone on bone. It doesn't mean it can't help some patients with bone on bone. It just means that your baseline chance of a significant outcome might be less than if you had less severe changes. A smaller tear within a tendon is going to have a better chance than a larger tear. So understanding these types of things is going to be very important. Now, once we understand the structural characteristics, again, we have to move on to, well, what is the proper dose to be delivered to that specific structural issue? And so we have to consider, how is the PRP being processed? And there's other considerations with this which we'll go in. Now, just a general kind of overview. In general, for PRP, you have to perform a blood draw. then your blood is either placed in an automated centrifuge, which is kind of set to produce a specific type of PRP. And those cells are spun at certain rates, and it will separate the cells by weight, which when the platelets in this little layer are isolated, that is what we call platelet-rich plasma, PRP. Now again, automated versus manual isolation, it's going to have some different characteristics of what you can get at the end as far as the type of PRP, as well as the dose. We're going to learn here shortly that the amount of blood you draw and the type of processing you have is going to have a direct effect on the final dose of that PRP treatment. So this brings us to the question, is all PRP the same? And the answer is no, it's not all the same. It's like saying all antibiotics are all the same. There's different types of antibiotics, there's different doses and frequencies that you might get. And in general, we can break down the different types of PRP into two main types. Now, there can be different classification symptoms, and you can get very specific about all the different cells involved. But in general, we can break the PRP types down into leukocyte-rich PRP and leukocyte-poor PRP. What that means is the concentration of white blood cells increased or decreased within that final PRP concentration and solution compared to your baseline. And again, you can get very specific with this, which can create many types of PRP, but we're going to keep it very simple here. Now, outside the types, there's going to be the different dosing. Some people will talk about, is PRP 2 times the concentration, 3 times the concentration, or 10 times the concentration of what the baseline platelet dose was found in your blood. So how many multiples of increase was there in that final product? But more importantly is how many platelets are getting delivered to the target location, which is what is really the dose. How many platelets are being delivered? And the influence of this dose is going to be the amount of blood drawn and then the efficiency of the processing techniques. And so these are just little things we have to think about, because this can have a direct effect on outcomes and overall benefit of the treatment. Now, as we can see here, the majority of people out there performing PRP use one of many different automated machines. And as we can see that some of these machines here, the platelet recovery efficiency and rate can be quite low for some of these systems. Some of these systems only have about a 30 to 60% efficiency at collecting the platelets. So what does that mean at the end? That means that you're going to be losing and leaving behind a lot of platelets that could have been delivered into your joint, tendon, disc, around your nerve, any of those things. Automated machines in general are a one-size-fits-all approach. You can't really adjust the dosing and concentration or the blood draw volume to create different types of PRP. And in general, this is the range of the efficiencies there, 30 to 80%, with the M-site machine being the most efficient at platelet recovery. Now, what we have here at our clinic is more of a manual flexible lab platform. This manual process gives us a higher platelet recovery, and we can make any type of PRP, any type of concentration, and any type of final dose. So there's just more flexibility when you're not in a rigid kind of automated machine situation. Now, most clinics don't have a big lab to process cells, and so they're a little more restricted. And again, as long as they have a good machine and depending on what they're treating, it may be effective and therapeutic. Now, if we move a little bit more into understanding what the optimal PRP dose is, again, this is going to be a function of how much blood is drawn and how efficient the machine is at collecting those platelets. So in general, for an arthritic joint or a soft tissue issue, you need to get a minimum of a 5 to 10 billion platelet dose delivered to the target issue. And this can be higher in older individuals to account for some of the kind of inefficiencies in our healing cascade. A lot of the PRP studies that showed failure of PRP to be better than the placebo was in low dose PRP, sometimes not even called, and meeting the definition of PRP, was no better than placebos. And so you have to get a therapeutic dose in order to see if you're going to get the therapeutic outcome. So getting underdosed from some of these clinics providing very low blood draws, very cheap, inefficient machines, you're going to have a very low chance of getting any significant outcome with a PRP treatment. And that's why there can be differences in cost, differences in the amount of blood. So if we look, just try to take some baseline examples of how much blood you might have to draw based on the efficiencies of the machine to get a final dose of platelets. If we're going to be upwards in the therapeutic range for most people, a person needs to draw at least between 60 and 120 cc's of blood, again, depending on the efficiencies, to get you to a therapeutic range of platelets. So if you're going to a clinic that draws 20 cc's, you will never get to the therapeutic range of platelet dose delivery into your joint, tendon, spine, whatever they're treating. You will be getting underdosed with a significantly lower chance of therapeutic benefit. Now, having said that, once you do have the right therapeutic dose of PRP, you have to be able to deliver it into the proper location. And so if you're going to a clinic that doesn't utilize image guidance, I would find a different clinic. If they're using just where does it hurt, palpation guided injections, then you should run out of that clinic. There are many studies that look at the differences in accuracy of an injection versus the landmark base, so where does it hurt, what we call blind injections, versus ultrasound guidance. We also use fluoroscopic or x-ray guidance. So getting into your joint of your shoulder, there's a significant more accurate delivery when you're using image guidance from the shoulder, the elbow, the hand, wrist, hip, knee, and if you're doing the spine, x-ray guidance. And most of these studies are utilized comparing orthopedic surgeons, high-level, credentialed doctors that are used to sticking needles or scopes or instruments into people's joints, and they are still not as effective as using image guidance. So if you're going to someone, they should definitely be using image guidance. And so these are some of the things that we do in our clinic. We might use x-ray for a knee injection. You can use ultrasound for a knee injection, seeing the needle right into the joint space and seeing the PRP or whatever solution you're injecting. Even if you're injecting gel or steroid, it's best to use image guidance because it's better to be delivered to the right location. Another ultrasound, injecting a rotator cuff tendon tear in the bursa with ultrasound guidance. Other ultrasound showing needle injection to the medial meniscus and the overlying ligaments around the patellar tendon of the knee and into a patellar tendon tear up here in the front part of the knee, ensuring that we're going to be putting the PRP in the proper location. Using X-ray to inject the shoulder joints and or labrum is another way to do it to ensure they be placed in the proper location. Or using X-ray guidance to inject around someone's nerve in their back for a disc bulge, herniation, or you can inject the disc or the other structures there as well with image guidance. Very important. Now that's really just a quick overview of things to consider with PRP, why you might want to consider PRP for your orthopedic condition, understanding that it's not the best thing for everybody. It's good to have a proper evaluation, understanding what's going on structurally, understanding how PRP compares to the alternative treatment options and the outcomes and success rates, and then being able to deliver a proper PRP dose and precisely place them into the affected tissues. If anyone has any questions, please write them down. I can get to them. And there's a question about how much blood is drawn. Well, it depends on what we're treating and how many structures. If we go back to this slide, if we're treating your knee joint and we're only treating one knee joint and we want to deliver more than 10 billion platelets, we're going to need to draw about 80 to 120 cc's of blood if we're just doing that one injection. If you're treating both knees and you need 20 billion platelets, so you can put 10 and 10, then you're going to be 160 to 240 cc's of blood if you're going to deliver the proper dose. So it really just depends on what you're treating. Are you treating a small thumb joint or are you treating a knee joint? Are you treating around a nerve or a ligament or a tendon? The joints in your spine can only hold 1 cc where your knee can hold 5 or more. So it really does depend on the amount of the specific structure and the specific, let me get this back up here. Let me get back to the end here. The specific structure and the severity. If we're treating an older patient versus a younger patient, we might go higher on the dose, which might lead to a higher blood draw, bigger blood draw. That's a good question. But again, it can be variable, but usually it's going to be in that kind of 80 cc if it's one joint, up to 200 or 300 cc's if you're treating multiple joints at high concentration. For PRP treatment, it's all kind of same day. Within our clinic, because we do all manual isolation and customized dosing, it can take about an hour for processing to be complete, but it's all done on the same day. There's a question about what is the healing time. So basically, when you get treated with PRP, there's going to be 2 days where you feel a bit sore and stiff. It's still good to be mildly active, but still protect the region. For 2 weeks, it's good to do more low impact activities, and you might scale back on your exercise. And then the tissue continues to improve over time. So if you track PRP patients on average, most people get significant benefit within the first month, but you'll see continued benefit for 3 months, and then you'll reach your max benefit from that treatment, and then that improvement can last for years. If you have a tear that heals, that can last forever. If you have more moderate arthritis, then you're going to see years of improvement. Some people it might take a couple of treatments to get there. So it kind of depends on what the underlying condition is, but most people will start to plateau and not see any additional benefit after 3 months post-injection. So I will say up on the screen is some contact information for our patient education center. Danielle is there, her email and her phone number. She basically gets people educated on our process and gets them scheduled for new patient consultations. She helps facilitate imaging and getting you into the clinic if you needed to be evaluated for any orthopedic condition. So she's a good resource. Our website, regenexxlasvegas.com, has lots of useful information. Regenexx.com has useful information and educational information. And so it can be used as just a good resource. So there's a question, what is the difference of PRP and stem cells? So the difference is the cells are different in their potential. So PRP, which we're specifically referring to platelets are activators of healing. They're stimulants for tissue repair, but they don't bind or respond to the environment. So they get injected and they release the growth factors, and those growth factors have their effect. Stem cells, which specifically we're referring to mesenchymal stem cells, these can be isolated from your own body. In places around the world, you can get them from umbilical cord tissue. Same type of stem cell, mesenchymal stem cells. The added benefit of stem cells is that they can respond to the environment that you place them in. And they may change what they do or provide to that tissue based on the environment, because they can adapt and respond in different ways. They can just release growth factors and proteins to the tissue. They can exchange mitochondria and other energy systems, or they can transform into a specific cell type. So stem cells just have more potential within a specific environment for healing and regeneration, depending on the severity of the problem. So it's just, there's different functions of the cells, and a little more potential with stem cells in influencing the environment and the cells that they're coming in contact with, essentially. So we tend to use stem cells for more advanced conditions, bigger tears, a little bit more moderate to severe arthritic conditions. Those types of things is where we tend to utilize stem cells more, because they can be more effective in those more significant degenerative conditions. Any more questions? So what's the evaluation process is another question. So for us, at least at our clinic, everybody gets at least an hour-long consultation. Depending on the location of the problem, sometimes we can just ultrasound in the clinic and identify what's going on structurally. Sometimes we'll need an MRI or a CT scan, depending on the region. All spine conditions need an MRI or CT scan if you can't have an MRI. And some extremity-based conditions will need MRIs as well. But the consultation is an hour long. That's where we'll go over imaging, physical exam, understand what's going on structurally to decide if PRP or other interventions are going to be the best option. And that's all done in the clinic. We are contracted with most insurances for the consultation, but not all. Danielle can help with the list. It's also on our website. And then within the consultation, if we have all the imaging, again, that's when we'll discuss candidacy, the process, scheduling, pricing, all those kind of things. What happens if MRI does not approve the MRI, or if insurance does not approve the MRI? Well, you can go outside of insurance to get an MRI. I mean, we have some contracted rates with some local facilities where a self-pay MRI can be as little as $185. So sometimes that's feasible for people to consider if insurance is denying the MRI for whatever reason. there's ways to get it, but in order for us to understand what's going on structurally, we have to have the appropriate imaging so people are educated ahead of time on their candidacy, what is the expected chance of success, those kind of things. So there's different ways to try to make sure we can get imaging if we really feel that the MRI is needed. And Danielle can be a good resource in trying to get MRIs either to me if you've already had them completed, or getting you in contact with us to help get you set up with one, or just come and be seen like you would in a normal clinic, and we can decide if you need an MRI, and then we can order it for you and go through that process as well. So you don't absolutely need to have one coming into the clinic, but oftentimes we might be ordering it as part of the evaluation process. I'm not seeing any other questions. If anything comes up, please reach out to Danielle. She can get you in contact with me in our clinic. She'll get you set up for consultation, like I said. Again, the hopes of these webinars is just to provide some education for people, plant some seeds in your brains to start thinking about things differently, and maybe have a little better understanding of some of the differences between these treatments, specifically PRP, and what that means. It's kind of a generic term that gets thrown around, but there can be little nuances and why it might help some people but not other people. So I hope you guys enjoy your evening. Again, thank you so much for logging on and listening to me chat at you guys for a while. I appreciate you guys, and have a good night.